So there are two different ways to perform hair transplants. One is what we call the FUE, where we take single follicular units from the back of the head and we transplant them to the front of the head or the area where the transplant is required. The other method is the FUT, where we take a strip of scalp along with the hairs and then we sit and we dice it so that we take out individual follicles and we transplant it. The difference is when we do the FUT method, we have a scar at the back of the head. There are indications for FUT, and sometimes we combine the FUT and the FUE techniques in the same sitting when we require large areas to be transplanted. This is an operation done under local anesthesia. Initially, there will be a little bit of pain when we inject the local anesthesia, but once the local anesthesia takes effect, then it's essentially a painless procedure. So, following a hair transplant, at the end of the procedure, we put a dressing on the patient's head, and it's like a turban, and which we take off after 72 hours, and then we leave it open. And for about a week after that, the patient wears a surgical cap like this. So the recovery process following a hair transplant is pretty uneventful. The back of the head where we take the FUE grafts from, in about 10 days time, there is sufficient enough hair growth, and within about 3 weeks, you are quite presentable because your normal hair would have grown back. The hairs that we transplant, the little scabs, they fall off in about 2.5 to 3 weeks. That's about it really. The only thing to worry about is, you get a lot of itching after the operation, which you need to stop yourself, otherwise you may damage the hair grafts. You can start washing your head about 10 to 12 days after the transplant. Of course, you will not stand under a shower where the water falls by force. You will use a mug, and about 3.5 weeks after a transplant, then you can do your normal showering process. So the hairs that we transplant, the shafts, most of them will fall off in about 3 weeks. And then there is a lag time of about 2.5 months. And at about 3 months, these new hairs will start to grow. And the final result of a hair transplant, you see around between 7 to 9 months after the surgery. At the end of 9 months, what you have is what you have. Well, the hair transplants are, we would say it is permanent, because the hairs on the back of your head, these hairs, they never fall. And so when you transplant those hairs from the back to the front of your head, these hairs will not fall. The transplanted hairs will not fall, but you may lose the remaining hairs that you have. So sometimes, maybe 7 or 8 years or 10 years down the line, you may require a second transplant to fill in the blanks. A hair transplant could cost anywhere between 2 lakhs to 4.5 lakhs, depending on the number of hairs that we put, and also depending on whether we do a combined FUT plus FUE procedure. Medications have no bearing on a hair transplant. The only thing that we need to worry about is if you have a patient who's on aspirin or blood thinners due to some cardiac problems, we ask them to stop those blood thinners for about 5 days before the transplant. After the transplant, you can restart those blood thinners. Otherwise, no other medications have any bearing on a hair transplant. Well, the most important thing I would advise people when they are looking to get a hair transplant is to please get a hair transplant done in a hospital setting. At the end of the day, it is an operation, and all operations will carry certain risks. And if you are within a hospital environment where a hair transplant is going on, if there's any eventuality or any complication or any emergency, there is medical staff to take care of it. That is my only advice to anybody looking for such a procedure. Thank you.